Are you wondering what is happening to your hair? You don't see a visible hair loss, but you do observe that your hair is getting thinned out. The volume is less. Hi, I'm Dr Jaspreet Kour, a dermatologist and trichologist with wide experience in treating skin and hair disorders. And today we are going to talk about hair loss and thinning of hair. It's completely normal and even healthy to lose up to 100 hair strands every day, as long as they keep growing up. But yes, if it's more than 100 or if your hair is falling in lumps, then that's an issue. So there are different causes. It could be some nutritional deficiency, protein deficiency, some infection that your body is trying to fight, or even autoimmune condition like alopecia areata. A very common condition which is stress, which we take very lightly, but it can even cause telogen effluvium, which again results in hair loss. Post-pregnancy, it's very common to lose a lot of hair just because of the hormonal shift your body goes through. So again, it can come back, but just make sure that you are using the right products and your diet is adequate. Certain medications for mental health and cancer medications can cause hair loss as well. It's very common as they are very harsh and very strong medications which affects your hair follicles. Other than that, hormonal disorders like I said, PCOS because of the high testosterone level, thyroid disorders can cause hair loss. If you're losing hair in small patches, then it could be any autoimmune condition. A very common one is alopecia areata, where small bald patches are formed. Sometimes they even coalesce to form a larger patch, or even totalis, alopecia totalis, where the entire scalp is bald. So it's again an autoimmune condition. That means your own immune system is damaging the follicles. Sometimes certain infections and skin disorders like psoriasis and fungal infection involved in the scalp area, seborrheic dermatitis, too much dandruff if it's there, that can also cause and lead to hair thinning and even hair fall. So before you start using some harsh volumizing hair products and even damage your hair further, so let's talk about what is hair thinning. So hair fall is different and hair thinning is different. They are quite similar, but there are some differences in between them. Losing hair could be due to some genetic disorder or maybe any hormonal condition that you have. It could be thyroid related, it could be PCOS, high testosterone level. So let's talk about hair thinning now. So hair thinning occurs when you're not using the right products, using very harsh chemical based products, over treating your hair, straightening, coloring very frequently, not taking care of your hair, not going for regular massages, not using the right shampoo, conditioner. Other than that, very tight hairstyles. If you tie a ponytail which is very tight, it can also damage your hair follicles. Hair thinning can even be genetic or hereditary. Some people have very thin hair naturally. There's not much that can be done, but make sure that you are taking good care of the existing hair that you have. If you are suffering from hair fall or even hair thinning, it's very important that you see a dermatologist so that the root cause of hair fall or hair thinning can be figured out. So I hope you like this video. Do follow and subscribe us for such informative content.